Hey guys, it's Denise. This is not a video I thought I'd ever be making. I had come down to my friend's house to stay for the week. My best friend in the world, Sal, who you're probably sick of hearing me mention, but he deserves it to be mentioned, especially when you hear what happened. I came down, I had my loose skin removed. I had the diastasis repair on my stomach. I went for my first follow-up appointment, had the first drain removed, was going to go back on this past Friday and hopefully have the second drain removed and drive straight home from the appointment, because remember, home for me is about 4 hours from my surgeon. Well, on Thursday night, and people, if you take nothing else away from this, please hear the next thing I'm going to say. If you feel like something is wrong with your body, don't be embarrassed to call 911. Don't feel like it's not important enough. Don't feel like they're taking care of more important things. Don't be embarrassed that you're going to get to the emergency room and people are going to be like, you look fine to me. I'm going to tell you what happened to me Thursday night. The vision in my left eye started to feel funny. Now, I had cataract surgery about 3 years ago. So my vision is pretty stable. I need reading glasses, as you all know. If you've watched any of my videos, you know I need reading glasses for up close. That's the trade-off. When you get your cataract surgery, they surgically, permanently implant lenses in that corrected my distance vision back to 20/20, which is what it was my whole life prior to the cataracts growing. So my vision has not been an issue. So Thursday evening, I was home alone at Sal's house. He was at work, and I started noticing that when I'd move my eye, like, look from side to side, I'd just catch the shadow of something moving. Like, the best way I can think to describe it would be, imagine if you're someone who's ever put contacts in, or if you haven't, try to imagine what it would be like if there was like a small dark colored contact, like maybe a gray contact lens stuck in your eye, but it was moving around and periodically floating into your field of vision and blocking it. Only for a second or two, and then it was gone and everything would seem fine. But then a little while later, it would happen again. No pain, no headache, no eye pain, no nothing that would immediately make you think that there was any kind of emergency going on. I will explain these in a few minutes. In fact, I'm looking at one of them and it reminds me my head needs to be tipped. About a half hour or so went by. It was happening more often, and now I was occasionally seeing a flash, like almost like a silver edge to the whatever was moving in my vision. Almost had like a silver or bright, if you want to think of it in terms of light, edge to it that was catching, and it was clearly right in my eye, so I'm seeing it as if it were being held super close to my eye. I haven't driven yet since my surgery. I still have one drain in, right? The next morning I'm supposed to be having the drain removed, and now I realize I'm having something going on. Now, I was a nurse for 26 years, as I've mentioned before. My spinal cord injury ended my career. Now, I was primarily a mental health nurse. I helped people mostly with mental health issues and addiction, which, of course, is, to a type of mental health issue. I don't really, I don't consider it separate, but in terms of, where you work, they're usually separate facilities. So I was someone who was used to, had spent my 26 years mostly healing the mind and the soul more than the body. But I remembered enough from nursing school to know, and believe me, like, I went to nursing school with the dinosaurs, but I remembered enough to know that sudden changes and part of your, especially if it's affecting like part of your field of vision, can be a sign of a detached retina, which is an emergency. Because if the faster they reattach it, better chance that it will stay reattached, and the better chance that you won't go blind in that eye. Again, I started to let that, oh, you're probably overreacting, it's probably nothing. And I was like, you know what I'm going to do? I'm going to call my friend Linda, who is like a second mother to me and who was a nurse for 100 years before she retired. She's one of the smartest people I know. I called her, and she's like, Denise, you can't drive yourself, obviously. You need to call 911. And I was like, I said to her, I feel like an idiot. I'm not in pain. I look fine. I just spent, 5 minutes in the bathroom mirror with my reading glasses on, looking in my eyes, and, they're not irritated. The left doesn't look any different than the right. She's like, I don't care. What you're describing is serious. And you need to promise me right this minute that you are calling 911, or else I'm calling them and sending them to where you are. And I promised her that I would call. And even though I was embarrassed and thought they'd think I was an idiot, I called. And I think the person on the phone may have thought I was a little bit of an idiot, and was, although to her credit, I think she was trying to keep it out of her voice that she thought I was an idiot. Or maybe just like a hypochondriac crazy person. I got to the hospital. The ER doc did blood work, which my blood work, I don't want to bore you with the details, because if you're not medical people, saying, my SED rate was almost 60 isn't going to sound high. But that also could be because I just had surgery. If I hadn't just had surgery, that would be alarming. But it could be in response to the fact that I just had surgery a week before. So they didn't make much of that. But he said to me, because I said to him, I sound like hypochondriac / lunatic. Like, I know I look fine, but I'm telling you, something is going really wrong in my left eye. And he's like, he totally believed me. Thank God. He ordered a CAT scan of my head and eye to make sure there wasn't any sort of obstruction of like the blood flow, or, any brain related thing going on that was causing me to perceive an eye problem. Those came back normal, so they called in an ophthalmologist. She came in. She was awesome. They set up little mobile ophthalmology office equipment right there in the ER. And she, dilated my eyes, did the exam, and she told me, she's like, thank God you came in, because your retina's detaching. And this needs to be dealt with immediately. Now, here's the part where I don't even like to. I don't even know that I've finished processing it enough to talk about it. But I'm going to tell you, because people should know that this can happen. And if it happens to you, fight it. Because I didn't fight it because I didn't know what else to do. The ophthalmologist was like, this is an emergency. We need to get you. I was at my friend's, which is in Rockland County. There is a hospital here, a good-sized hospital, but they do not have a retina specialist on call 24 hours a day. The next county, now, not right next to us. I'm in the Hudson Valley. If you're familiar with New York State, where I'm visiting is in the Hudson Valley area. So I am on the Rockland County side of the Hudson River. Westchester Medical Center, which used to be an extremely well-respected, I have to say the reputation has gone to shit. And having had the experience that I had there, I know why their reputation has gone to shit. The ER doctor where I was at Good Samaritan Hospital called over to Westchester and said they had someone who urgently, immediately needed to be seen and needed surgery to prevent to prevent me from going blind in my left eye. And it looked like I was getting ready to be put in an ambulance and sent to Westchester. The reason now I would be sent there was because they have more than one retina specialist and one always on call. That's what he was told. So when the eye doctor who saw me and diagnosed it Thursday night at Good Samaritan Hospital left, she believed I was being transferred in a matter of hours and would be having surgery within either that night or at least be getting prepared for surgery first thing in the morning. Because the clock starts ticking the second you start having the symptoms. You can't delay getting this treated. That's what I was saying before. Do not delay. If you start having visual changes, whether there's pain or not, do not delay. Do not go blind out of embarrassment because you didn't seek treatment. Please, please, please. So I'm sitting there. I'm waiting to hear when I'm going to be transferred. I'm nervous, of course. I'm scared. I know there's still a possibility I'm going to go blind in my left eye. And then the ER doc comes back a little while later and tells me that Westchester Medical Center has declined to accept me as a patient at this time. They've decided that my condition is urgent but not emergent, which to me sounds like they didn't feel like bothering the on-call, or the on-call didn't feel like bothering coming in because me going blind wasn't important enough. They told me to go to the retina clinic to be there at 9 a.m. Now the clock's ticking, people. It's 10 p.m. They're talking like almost another 12 hours. And to go to an outpatient clinic as a walk-in? But they were offering me no options, and they were refusing to accept me, and there was nowhere else to go. So we went home for a couple hours, got some sleep. No one told me not to lie on my back, which may have caused further detachment. Because I now know I have to spend 4 nights sitting. The past 2 nights I have slept sitting up on this couch you see behind me. I absolutely positively cannot lay down. No one told me that. And they sent me home. We got there early in the morning because we were told the clinic didn't start till 9, but that the staff get there at 8. And being that Westchester Medical Center is huge. It's like its own little town. It's like a big, badly, poorly planned college campus that was added on to, over many years in different expansion periods, and like the layout makes no sense really. If you don't know the place intimately, which I don't, finding the various buildings is close to impossible. You see so many people driving the wrong way, trying to make U-turns out of one-way streets, because I'm telling you, this place is a nightmare to navigate. So luckily, once we realized we were, we went to the main building to ask them where to go, that we were told. First of all, then they had no record. Let me just tell you that part. No record whatsoever that Good Samaritan Hospital had called them the night before, had referred me. Luckily, I had the paperwork to show them, the doctor's name who had been called and spoken to and who had told us that I needed to be there for 9 a.m. for the clinic. Nobody at Westchester Medical Center seems to know how to get anyone else at Westchester Medical Center on the phone. The security guard was like, oh, well, we don't have the extension for this person. They're in another department. I was like, are you flippin' kidding me? I was a nurse, I told you, 26 years. I spent a long time in one hospital in particular, Good Samaritan, the one where they diagnosed me, because I used to live down here. This is why my family and friends are down here. So they have zero record that there has been contact that I've been referred to them. So they're like, okay, we're going to send you over to the eye clinic, the retina clinic. They tell me the name of the building. Can they tell me how to get there? Nope. And again, imagine a sprawling, like small town sized campus of many, many buildings, lots of parking lots that you have to, pay to get into and out of. So if you make the wrong turn, now you're paying another $6 to get out of a parking lot. Lots of one-way that you don't realize until you've made the turn that it's a one-way. I think half the people driving around at any given point are just lost. So I called my friend Linda back because luckily during her many years of being a nurse, they included being a charge nurse manager on the children's psychiatric unit at Westchester. So she knows the place. She was able on the phone to give us enough pointers to get us to the building where the eye clinic was supposed to be. We get there. They, again, no record, never heard of me. I show them the paperwork. And they inform me, after letting me sit for a half hour, they inform me that there is no retina clinic today. That's only once a week. And it's not on Fridays. It's on Mondays. And I was like, people, by this point now, it's gone from flashes of vision loss to as we speak, imagine if the bottom third of your field of vision, if someone poured black ink in there, because that's how I'm seeing right now. They sent me and told me I had to go to the emergency room, and I'm like, but I've already been diagnosed by an ophthalmologist. I've got the paperwork here proving this. I was supposed to have been transferred here for surgery. I'm going blind as we speak, and you're not doing anything. The attitude was nobody gave a crap, if I'm going to be quite honest. Nobody gave a crap that with every minute that passed, the likelihood that my vision will return, or worse yet, that I won't go completely blind in this eye, was just getting worse and worse. So finally, no one's going to tell me anything except go to the emergency room. So we find the emergency room. More parking, more paying. The emergency room has to start me over, even though I'm showing them the paperwork from Good Sam. They, again, never heard of me. No one ever called them. Not in their system that there was any contact with another hospital last night regarding a patient being transferred and who they then declined. Nothing. So we start over as if I've never seen a doctor, and the clock is ticking and my vision is getting worse. I had to go through the whole time-wasting process of waiting in. Now, Westchester has had 57 cases of coronavirus as of our first trip there. I did not want to be sitting in the emergency room, waiting room, full of sick people. I still have a drain from my surgery that hasn't been removed. That's an opening directly into my abdomen. I don't need to be sitting in a room full of sick people. And especially at the major medical center of a county that is having a serious coronavirus outbreak. They finally get me into the ER, where again, I'm like, please, someone just call an ophthalmologist, call the retina specialist, that's who I need to see. Nope. We have to go through the whole, let me triage you, then sit you down again, then, I'm like, I can't believe this. I can't believe this. No one would call the eye doctor until I'd gone through the whole long process, even though I've got the papers in my hand showing that I have a detached retina. The ER doctor has to see me and then make the initial call to try to get someone to get the ophthalmologist on call to come in. Not even the retina specialist, just an ophthalmologist. Now, as we know, I've already been seen and diagnosed by one of those. This is a teaching hospital. So I get one real ophthalmologist followed by two, I guess in various stages of training, mini ophthalmologists. And I don't mean that as far as the size of the people. I mean that in their level of training. And I was a nurse. We all start somewhere. I have nothing against teaching hospitals or having people observe who are learning. That's how we all learn. What I do have a problem with was the delay and the fact that they wouldn't even call the retina specialist when I'm holding a piece of paper that a fully certified grown-up ophthalmologist has already diagnosed a detached retina 12 hours ago now at this point, over 12 hours. After they decided, guess what? I have a detached retina. Then they put in the call. Because at that point, they tell me they're not even sure if the retina specialist is in the building or is available after they've already had me waste hours being there. Fortunately, it wasn't that long after that the retina specialist did come in. He agreed that it needed to be taken care of. He said he would be back, after he examined me himself, and of course used it as a teaching opportunity for the two guys that followed him around, the tall guy and the short guy, as I think of them. Tall guy obviously being the newer student, short guy obviously being far more further along in his training. Within about a half hour or so, he came back. They took me to a procedure room. They told me, if you've heard me refer to the lie that is often told in healthcare, that this is going to be uncomfortable, this was not uncomfortable. This was such excruciating pain that I actually started to vomit. And as you know, I just had abdominal surgery a week ago, so I'm using both of my hands to brace my abdomen, because when you start gagging and retching and dry heaving right after you just had abdominal surgery, you can rip all your stitches, and all of my stitches are internal. On the outside, all I've got are steri strips. All my stitches are internal. If they start popping, I'm back to the OR. So I'm holding my stomach together while I'm gagging and retching, because this wasn't a little pain. I'm not a wuss. This is something that you should be unconscious for. No one should be conscious while this is done, while you have cryosurgery done on your eyeball. And I didn't wuss out. I didn't freak out. I was like totally good while they were injecting the lidocaine directly into my eyeball. Like, I didn't get the nerves. I didn't get the gross out. I was being totally calm. I was just happy that someone was finally doing something. So like, I'm not one of those people who gets hysterical because, oh my God, you're touching my eye. No, I was so happy that they were finally going to do something. And after the first lidocaine injection, he poked around a little bit, and it was like, okay, I guess I'm numb. Well, apparently just the very outside of your eye gets numb from that, because when he went in with that metal probe to do the cryosurgery around the tear, I don't have words for the pain other than to say my body reacted by vomiting. That's how strong it was. As I'm doing this and retching and doing a full sit-up, by the way, on my freshly cut open abs, because it was just an instinct. You don't want to choke on your own vomit. When you feel like you're starting to vomit, you automatically sit up, which of course I'm doing while trying to hold my stomach together. I didn't see who it was, tall or short. Someone grabbed a garbage can and got it up near my face. And obviously the doctor had to pause for a minute because there was now a garbage can blocking his access to my eye. Then there was this disaster with, okay, I'm taking deep breaths. I'm trying not to puke. They offer me a glass of water. I just had dry heaves. I didn't actually bring anything up because I hadn't eaten in well over 24 hours at that point. I hadn't had anything to eat or drink. And I'm like, I'm hypersalivating, like that too much saliva feeling you get before you vomit. No, I don't want a drink of water. Like, what I want is someone to call Amnesty International, because like, this shouldn't even be done to war criminals while they're awake, let alone to normal people. But now we're past the point of no return. I'm going blind if I don't let him finish. So he's like, see, my arrow isn't pointing straight up. My head has to be turned again. He's like, I can finish in 5 minutes. You need to let me finish, okay? Because if I leave this unfinished, you're going to go blind. And so of course, what were my options? I had to let him finish. The pain, again, there are no words. There are no words for the pain. And it was like, good luck with that. There was 0 pain medicine given afterwards. The pain was excruciating. It hurts to touch my eyebrow. It hurts to touch my cheekbone. Obviously, I couldn't see what he was doing because they were injecting stuff in my eye. And this I may have to get laser treatment still done to inside my retina. We're not talking LASIK on the outside. Your retina's in the back of your eyeball, if for anyone who is not familiar, with the anatomy of the eye. Your retina is the back wall of your eyeball. So they're working back there, not on the surface like they do with LASIK, that they do for vision correction. So after inflicting pain upon me to the point where I vomited, or I should say dry heaved in horrific agony, they offered me 0 pain medicine and told me that the tear was, if you imagine, that you're looking at a clock face, my tear was at 1 o'clock, hence the arrow drawn. My head needs to be tipped at this angle with the arrow pointing upwards, so that the bubble of gas that they then inject after the cryosurgery was the part that was causing the pain that was so bad that I wish I would have just passed out, because passing out would have been so much better than staying awake for that. They then inject a bubble of some kind of gas to help create pressure to help the retina stay attached to the wall of the eye. So I was told, keep your head tipped forward a little bit and make sure that your arrow is pointing straight up. For 4 days. You can't lay down. You can't, you can't lean back. Don't lean forward. Don't lift up anything. Nothing that would increase intraocular pressure. And that they needed to see me the next day. Now keep in mind, this is like almost an hour away. So I saw them yesterday, which was Saturday. The doctor had originally told me he would need to see me in a week. But when I saw them yesterday, they said they need to see me Monday. So I got not a week, but 1 day that they're not seeing me. I don't know if that's a bad sign. I don't know if it has to do with the doctor's scheduling. I don't know anything because they don't tell you anything. I know that right now, the bottom part of my vision is black. I don't know, and they can't tell me, honestly. They can't tell me if that will ever go away. There's apparently some hope that the pressure from the gas that was injected into my eye will help force some of that fluid back where it should have been. That leaked, I guess, out of the part of my eyeball it was supposed to be in and went into the part it's not supposed to be in. So there's no guarantee I'm getting back the vision I've lost, which I completely blame on the time lapse. Here, I'm told, thank God you did the right thing and called 911 and got yourself immediately to a hospital. And then the hospital, which is supposed to be the center of excellence that they send me to, decided I didn't need to come until the next day. And it was during that night that the vision went black at the bottom third of my eye. So I blame Westchester Medical Center for the loss of vision. If they had fixed this immediately when I didn't have this, I think the chance would have been much better. There's still the possibility that the surgery won't take properly and that I could lose all of the vision in my left eye. I'm certainly hoping that doesn't happen. There is a very good chance that the visual loss that's current is permanent. Like I said, no one could make me any promises, and this I know is reality. I can't blame them. I don't think they're being dishonest. They really don't have any way of knowing at this point if the vision's going to come back. That's a wait and see thing. But tomorrow, Linda and my mother will be taking me back to Westchester Medical. Keep my arrow straight, Denise. So that they can see what's going on again. If they say they need to do the surgery again, either the cryosurgery, which it was explained to me, has a few points lower success rate, but the benefit is it has a much, much lower complication rate. That's what I was told, and that my tear was relatively small, and that's why the retinal specialist said that in his mind it was the way to go. He then ended it with, I might need to see you in a week and do some laser work. And after having gone through what I went through, I'm telling you, if someone says they want to, if they want to touch your retina, you want general anesthesia. Like I said, not a wimp. Didn't even get squeamish about seeing someone putting an injection into my eyeball. Didn't even get squeamish. So when I tell you this pain was not something that should be inflicted upon a fully awake person, I'm not kidding. Over the next few weeks, apparently my vision will either return or it won't, or I will lose what I have. That all depends on how it heals. And I get to keep going back to the epicenter of where coronavirus patients are being sent in Westchester County. Not happy about that at all. Up where I live in the Adirondacks, there are no cases yet. And it's so sparsely populated that it's like a joke. Don't go to a crowded place. We don't have crowded places. But like I said, right now I'm looking at possibly becoming blind in my left eye. I already lost my career because of spinal cord injury, and I live with the deficits of that. And I'm now looking at the very real possibility of losing the vision in my left eye, either even with the amount I've lost, I don't know how I'm supposed to drive. I drive a big, full-size Suburban. They're on a truck frame. They're not even on a car frame. You have a big, no joke intended, blind spot when you drive a large car or truck, as a lot of people probably know. That's why a lot of them have those extra mirrors. But I've learned that even with the blind spot mirror, you can't 100% trust it. I always look over my shoulder, completely look over my left shoulder to make sure there's no one in my blind spot before I change lanes. If I can't see out of my left eye, how can I drive? But again, if you take nothing else from this, please, if you're having, whether it's eye pain, chest pain, you think it's just indigestion, whatever, get medical treatment. Get medical treatment right away. It's better to find out that there was nothing wrong. It's better to find out it's something mild, that it's just going to go away, than to have something terrible happen to you because you literally died of embarrassment, or in my case, almost went blind because of embarrassment, because I felt silly calling 911 when it didn't even look like there was something wrong with me, when in fact there was something urgently wrong with me, emergently wrong with me. So please know that if you think something is wrong in your heart, you know something's wrong, call 911. Don't be shy. Don't be embarrassed. Get checked out, because it might make the difference between life and death, or in my case, it might make the difference between losing your sight or not. So thank you for watching, and take care of yourselves.